There's a delay.
Good evening, Sandites. Welcome to District Dialogue. It is Tuesday evening at 7 o'clock. I'm glad you joined us today. Tonight I have with me Kristen Arnold, Assistant Superintendent over a lot of things actually, HR, but student services as well. So some of you may have talked to her on the phone occasionally. And then of course, our esteemed Ms. Janelle Wright is to my right. One of our school nurses, Lindsay, could not be here with us tonight. She's actually partaking in her leadership group that she was elected to. So very proud of her. But anyway, we have a couple of definitely some topics that we need to cover tonight. We're going to try to talk loud and articulate well, because I know with masks on it's a little bit hard to hear us. So we have now completed, I believe, goodness, week 14. We're almost at the end of week 4, not end, but beginning of week 14 of school. I will say, someone said today, this has gone so fast, and looking back, I can't believe it's already December. I don't know if you guys feel that way, but it has been a road for sure that we have traveled this year. So we're going to start tonight talking through some changes in our health guidance. And I want to preface that with you all understanding that lots of considerations go into changes in the document. We had formulated a health guidance committee early in the summer that included some teachers, some parents, some members of our leadership team, definitely members of my cabinet, and of course our nurses as well. And you know that the guidance, I'm sure, has been posted on the district website then since August, really. And we've had a couple of changes along the way, but tonight specifically we have a couple that we felt like it would be great for us to get online and talk about as we move forward. So probably the biggest topic that has happened lately, one of the biggest, is the changes in the CDC guidance for additional quarantine rules. So I know Janelle's been living that life at least this week as we adopted those pretty much the day after that came out. You know, our goal honestly is not to try to quarantine students, but at the same time, you know, the mechanism is to keep the staff safe. And so I'm really pretty proud of the job that we've done, making sure that we have, to the extent possible, kept our kids in school. So I'm going to let Janelle, if you don't mind, Janelle, kind of describing, you know, originally we had the 14-day quarantine that was required.
Just really quick, Superintendent.
Absolutely.
For questions.
Oh, thank you.
Because we had that new thing with chat
Yes.
and Facebook Live.
Right, so I forgot, thank you for that reminder. So if you have questions, there is a Google form, I believe it's posted to the bottom banner. If you could put your questions in our Google form rather than in the chat, this is what we're going to be using to answer questions tonight. So same routine as we've had the past few times that we've had dialogue. So if you could just drop your questions, good point, Kristen, into that link, that would be fantastic. So quarantines began with a required 14-day quarantine from the last exposure. And that's what we've been operating on now since school started, honestly. And so last week, we did that kind of turn on a dime action, and midweek we incorporated the new guidance. So if you don't mind, could you kind of go through exactly what the CDC says about how we can reduce the days of quarantine?
Sure. There are a couple of options. Instead of a 14-day, they still recommend a full 14-day quarantine, but you can come back after 10 days from the last exposure if you're symptom-free and it's been 10 days. You can reduce that even further if on to a 7-day, you can come back on day 8, you have to serve a full 7 days. If you get tested on about day 5, 6, or 7 and you have a negative result, you can come back after serving a full 7-day quarantine. It is still recommended that you follow and monitor your symptoms for a full 14 days, continue to wear a mask, take all of the precautions. Any signs of symptoms, of course, stay home and notify us and notify your physician.
Right.
So we're still following a 14-day quarantine, but we can condense that to 10 to get back in school.
Under some restrictions.
Right.
So if you don't mind, Sean Beard, our another assistant superintendent that really is that person that keeps us all straight with technology, he's running the show tonight. If we could pull up the guidance, Sean, if you don't mind, and show that piece. And so I'd like to look at those new CDC guidelines. We have this highlighted in yellow. And this is not, actually part of this is on the website. We did make a small correction today regarding those extra precautions. But let's just kind of go through these and notice there's an updated CDC guidelines link that's underlined. And if you pull this up, we'll be posting this new guidance really tonight. We're trying to get it up tonight. It may be in the morning. But if you click on the link, it'll take you directly to the CDC website that will show you where we got our information and what where we linked for that. So basically, if you've been in close contact with a confirmed case, we ask you to contact your physician and do not come to school. We're looking right now at page 21 of the guidance, and these are relative to students, but Kristen, I know you do HR. This would apply
Also to employees and, really just a general rule for anybody in our community or whatever. So if you're just a community leader, you don't have any children in school, you're listening to this tonight, or you're at the water cooler 6 feet from that person by you and they were asking about those things, there's really some great guidelines that are in there.
Absolutely. So, so the second bullet, a quarantine period is required starting from the last day of close contact with a person who has a confirmed case of COVID. So that's what Janelle was mentioning. So if you are at home, one of the examples, Janelle, I believe would be, say, a parent is at home with COVID and a young child lives with that parent. Can you explain that last contact, what that means for us?
Sure. We follow a couple of different scenarios. If the child can take care of themselves and the parent, or there's two parents household or older siblings, the positive person can isolate away from everyone else. That includes having their own bathroom to be able to use. Then anyone in contact with that positive person will serve the 10-day quarantine.
So it really has to do with the ability to isolate away even in the home, which is hard.
Right.
For some families, that's super hard, but for some, we have found that some families have that ability. So if I was positive and could stay in my room with my own bathroom and away from the rest of my family, then I could start and really utilize that 10-day window. Okay.
Yes.
So quarantine can end after day 10 without testing if you have no symptoms and you've been monitoring those. It's interesting symptom-wise, Kristen. We have been kind of noticing we had a little issue in our office with some people, and symptoms are really different.
Right. It doesn't just rely on a fever, which at first when the guidelines came out, and most businesses and places that you go into were taking a temperature every day and monitoring your temperature. And that's the strange thing about COVID is you just never know what your symptoms are going to be like. Everybody is so different. And with it being cold and flu season, I know strep throat is going around. It's just that time of year that those things happen. I'm real susceptible to that. I went and got tested one other time and tested positive for strep, but of course didn't have COVID. And the clinic that I go to here in Sand Springs, they won't test for strep right now because it's too closely related to COVID. So those are all things you kind of got to think about with your child, where they're at, what are their symptoms. But I never ran a fever, and then a lot of people are just like, it's allergies, but that's how it starts for a lot of people. And in that quarantine time that you were talking about, when you're home for those days, if you test early and you come back on that 7th day, it's important to say that those children or those people that are coming back must wear a mask,
Right,
which we're going to talk about a little bit
right,
later.
absolutely,
That they have to have a mask on when they're coming back
right.
the
So
entire time.
that's just curious, because I know our guidance still uses, we ask people to take their temperature when they come to work, but we're noticing that fever may or may not be indicative
Right.
of a positive COVID case, and it does start out with allergy-like symptoms that seem like it's the weather changing, or maybe even a headache.
Headache, we've also heard just aches and pains in general, like my back hurt, my legs were achy.
Tired.
So, tiredness, achiness,
Fatigue.
runny nose, headaches.
Right, right. So there's a lot of different symptoms that could be indicative of COVID that you might think might be something else. So go ahead and scroll it down, Sean. So this is the part that we really can reduce. And as Janelle was explaining, when a diagnostic test are sufficient available, because sometimes it takes a while to get the test results back, then a quarantine can end after day 7, So you're still quarantined at day 7, but you can come back on day 8 if your test resulted in a negative result.
Yes.
And you had no symptoms reporting as you monitor your health daily. The other nuance is that that test, the specimen, it says, has to be collected within 48 hours before your planned quarantine discontinuation. So that would mean, that's where Janelle came in and said the 5 days or later.
No sooner than day 5.
Correct. And then those open bullets that are right below that kind of go into that a little bit, but then this is the part that you have not seen if you've looked at the guidance and the updated guidance. The third open bullet was inadvertently left off when we first wrote this, and basically saying people must adhere strictly through quarantine day 14 to all the recommended non-pharmaceutical interventions, such as washing your hands, watching your distance, and most importantly, wearing the mask. So if you do develop any of those symptoms, we would ask you to self-isolate immediately, and then contact your healthcare provider to report.
Just something I want to point out too is, I know we probably have teachers and parents, all kinds of people that are listening to us tonight, and just a concern. I mean, we're doing everything we can to keep school in, have our kids continue going to school and keep our students safe and our teachers safe. But with that said, I've heard from a couple parents that were concerned, like there's distance learning that's going on, and a parent might tell, Mrs. Wright or Lindsay that they are quarantined within the house, but then, they've got other people walking around behind, and you can kind of see that they really aren't quarantined. So we really are taking it at their word that people are, self-quarantining at home and really practicing that. And if you have questions about what that looks like for that quarantine at home, I'm sure the nurses would be able to help you with kind of what those guidelines and what that would need to look like. We had, I'm just going to be honest and say personally, had a case in our house, and we quarantined. I mean, there was no meeting in the middle, and if you had to go to the front door, it was a mask and the whole 9 yards. So we're way past that, but and nothing really heavy. But it's just so important that that we're all sharing the truth and what's going on in our homes to keep everybody safe, to keep the spread from happening.
Absolutely. And I will say, one of the first recommendations in our guidance is if you are sick, stay at home.
Yes.
We kind of admire people that want to push through and come to work and get that done. And that's always been kind of that characteristic that shows good work ethic. And we understand that, and that's great. But in this age and this time, it really is better that if you're not feeling well, there's grace. And so we would ask that you keep your child at home. Also in the guidance right below where Sean's looking, it's the next bullet, we did include the link for other symptoms. So even though that fever is one that the CDC highlights, there is a link that goes straight into what those other symptoms are, and there are several of them. So let's go back to the question, Sean, because I know one person had written in a question, and this probably is a good time to talk about it. It's the fourth one. Can we show that one? concerning COVID-19. Can you explain how tracing is being done in the middle school? And I appreciate the thanks. That's awesome. And so this is, we say it in the guidance, but then when the rubber meets the road, we do have systems in place. And so this is perfect question, because Ms. Wright is assigned to Clyde Boyd Middle School, so she's working through a lot of those. So Janelle, I'm just thinking, let's talk about what would happen if I'm a parent and I call you and I say, Ms. Wright, here's the thing, my husband's home sick with COVID and my 7th grader has been exposed. We didn't know he was tested, so he was actually at school on Thursday. What would that trigger for you, and how would you start that process?
So at that point, the student was in contact with a positive case. The student is not positive.
Correct.
So what we would do, that's when we would recommend the quarantine for the student. We would find out when was the last contact with that parent. Are they able to isolate within the home from the parent? And then that's when we go over our dates. If it's a 10-day quarantine, and explain the quarantine process.
So he would only quarantine. There would be no effect on other students.
No.
Okay. So let's give you
So
another.
that's called secondhand exposure.
Right.
That's
Like
right.
secondary exposure.
And when you find that out, just out of curiosity, and parents might want to know this, so he did not test positive, so there's no reporting to the State Department at that time, or
No.
that only happens if we have a positive case that we need to report, and all that gets reported.
And we keep track of when that student was in class last, in case we do get a call that student has since become positive. Then we know when the student was at school last, and based on when his or her symptoms started, we may need to quarantine contacts in class.
So let's go down that path. So I'm again a parent, and I call you and I say, listen, my son it's Wednesday, and my son was at school yesterday, which would have been Tuesday. He had a headache, but I didn't think anything about it. And he came home and he really just was super tired and kind of got sniffly. I got worried. We went and got a rapid test last night, and the rapid test showed positive. And he was in school yesterday. I'm so sorry, but I didn't think about that being a COVID symptom. So what would that trigger for you, Janelle?
Well, we would find out, well, you already said when he was at school last, we would find out when his symptoms started, and then we would look at seating charts. That's how we do it at the secondary level, is pull seating charts for every class that student would have been in, and who was there on those particular days. So if we have a student that became positive and symptoms started on a Wednesday, we would trace back to Tuesday and even Monday, because you could be infectious 2 days before your symptoms start.
Gotcha.
So we would look at attendance in those particular classes according to seating chart, and that's how we know who to quarantine.
So when you say seating chart, then you're looking for the kids that are sitting directly around him,
Right.
correct? Yes. Okay. How would potentially...
But he also played sports.
Oh, there you go. So Kristen's adding a little nuance.
Okay.
So he's on the basketball team
Okay.
too. So how does that work?
Well, we
They
would
had
need to
practice.
find out when practice was last, who all was at practice, and quarantine the team.
The team. That was a little bit of guidance we got from the Tulsa Health Department, specifically about basketball. Wrestling may be a little bit different. If you've got wrestling partners and you're only in close contact with a few people, basketball's a little tricky, and they will tell us, and I know you've had this conversation with them, that it is a team quarantine because it's very close contact. And so I do know some of our cases coming back to school. I know we look at Charles Page and kind of those required quarantines that come back positive. I asked Lindsay a week or so ago, are those a lot of those athletes? And she said yes, because it is a higher risk activity that would quarantine based on close contact. So those are a little tricky, but that's how that works. And in a positive case, then my son's positive, when can I come back to school?
The positive case can come back after they serve a 10-day isolation, starting when their symptoms start.
Gotcha.
So if his symptoms started on Tuesday, Then we would do a 10-day isolation. He could come back after 10 days as long as he's fever-free, symptoms have improved, he's allowed to come back.
I think that's what confuses sometimes people, because quarantines, the way we have had to do those in the past, have been longer as a quarantine period versus I have COVID,
Right.
and then the isolation period has been shorter. And I think that has caused maybe a little bit of confusion. So again, I will say that all of our administrative team and our nurses actually went through the Johns Hopkins tracing class, which is it was a good
20
chunk
hours.
it's a good chunk of time before school started. And then of course every positive case we have to contact the Tulsa Health Department, and they guide us through those procedures. So I think that's helpful. I hope we answered the questions on that one. Let's see, what was the one that just came up, Sean, that I noticed? Let's see, I thought it was related. Let's look at that. If we are enforcing masks, what is being done to teach students, admin, and staff the proper way to wear masks? Stop touching your mask. No doubt, I need to stop touching my mask. My husband may have sent that in. We work on that every day. From the get-go, and I have to tell you, I kind of tease about, I don't tease about it, nothing's funny about it, but I will say this, at the very beginning of the year, we did a whole scenario on how to wear the mask over your mouth and nose. No doubt it is tough, mine's falling down because I've got this nice little paper one that keeps sliding, but that's a tough one because we really do try to encourage our people to wear it the proper way, and that's a big deal. As I'm touching you, so I love that comment. You are exactly right.
Honestly, on those new CDC guidelines, they'll kind of lead you to how to wear a mask. It really is kind of interesting that now they have like visuals of, how you're supposed to wear it, how you're not supposed to wear it, and you're not supposed to wear the ones with the little ventilator kind of down in the corner because you're still breathing out.
Right. Let's kind of go up, because there's another part I want to cover before we get off this. So let's go back to the guidance and let's talk about masks with our younger students. Let's go up, I believe it starts on page 11. And again, I need to preface this with every decision we make is a stress point for us. And we talk over and over and over again about how best to apply recommendations. I will say that when we decided to use the CDC as guidance, which most districts, at least across the state, have chosen to do, we were advised to make sure we were following them exactly as they're written. So let's talk about the students, and specifically tonight we want to talk about our littles. And Janelle, I'm going to, if you don't mind, addressing what we're seeing with our pre-K through grade 3 in terms of positive cases.
We have seen an increase in pre-K and kindergarten, some third graders as well, and those are the grades that masks are not required while they're in class.
Right. So let's look at, and that's unnerving. I know that there's a certain amount of anxiety that comes with our teaching staff about exposure, and of course we know that one of the most important things that we have to think about in order to keep schools open is staffing. And not just with teachers. We had the conversation today about, we're also talking our custodial who cleans our buildings, and our child nutrition folks who serve our meals, and of course our bus drivers. I saw a question about masks on buses, and I hope we have time to answer all of those. So we're going to try to do that all. So while in the building, this is a change. I will say I've been in each elementary site the last few days and have really watched how students are responding to mask wearing. And I have to tell you, I promise some of our little people are really good at it, maybe even better than some of our adult people. And I'm super proud of it. But I do want to bring up bullet number 3 that you see on the guidance, and this is the part that we changed. It's a small part, but it's a big deal. Due to state and district increases in COVID-19 cases in younger students, and notice there are 2 links here. One is state, one is district. So the state link, Sean, if you could pull that up.
It may take a second.
That's okay. This is some data that came out a week or so ago from the State Health Department that was pushed out to the State Department of Ed. That's it, yeah. And it's cases, and if you've studied the case reporting at all, you know that it's presented in cohorts by age bands. And what you're looking at is report from the month of August to where pretty much we're at in December. And you see that in August, they're showing a spike right about the time school started of 23 cases reported in that age cohort on the 24th. And in November, a high of 686 cases in that cohort on November 28th. So not only is the district seeing cases that are now happening at school, and I don't think they're happening at school, but they're coming to school, we know they're positive. But our district is showing some cases as well. So go ahead and go back, Sean, and see if you can pull that link up to our district chart. And here's, hopefully.
Yeah, it takes a second, sorry.
You're good. So here's our district chart. Sean helped me with this one today. We have the table data, but we thought it would be great to show it on a chart format. And you're looking at the student positive cases by grade. Fifth grade, of course, and fourth grade have been wearing masks all year long. My suspicion at the beginning, and I'm all about telling you when I predicted wrong, was that we probably wouldn't see very many cases at the elementary pre-K through grade 3 level, and we are seeing them. And so, hence, we, as a committee, met, I think, November the 12th, mid-November. I'm sorry, hold on, if you remember. Right, yeah. And we promised that committee that we would watch the cases in those grade levels and make a change if we saw an increase, and we have. So let's go back to the guidance, Sean. I'm making you work tonight, aren't I?
I'm a little slower than I used
That's
to be.
all right. So here's the guidance. So I'm going to read the third bullet. Due to district and state increases in COVID-19 cases in younger students, students in grades pre-K through grade 3 will be required to wear a cloth face covering at all times, but may remove the face covering while eating lunch, during vigorous indoor physical activities, and during outdoor activities. And there's CDC guidance that's linked. There's 2 open bullets underneath that. Cloth face covering breaks should be very limited. We still are going to obviously give breaks while in a classroom, and should be implemented at a time when social distancing is possible and for less than 15 cumulative minutes during the course of the day. Of course, 15 cumulative minutes, Ms. Arnold, is because the guidance was changed.
Correct. It used to just be like if you were together for 15 minutes, but now you got to think about that. Was I around that person that close for 15 minutes or longer?
Total, yeah,
Yes.
throughout the day. And then the second, of course, open bullet, if any time district data indicates stability in the prevalence of cases for students in grades pre-K through grade 3, the district will relax this requirement. We had leadership meeting. We've been talking through this for a couple weeks now. Had a leadership meeting today. Of course, I text you guys, Janelle, because we meet with you all pretty consistently throughout the week, talking through this part. And then we met with our teachers this afternoon in a Zoom meeting, and consensus really was this should happen. So we're asking for that to happen. Like I say, I visited the elementary sites. I know you're in several of the elementary sites. Tell them, share what you're seeing with mask wearing with littles.
They're doing great. They really are. I think some of it is they want to be like the big kids as well. But
Right.
They're doing great. I think as a community, we're doing well with having them wear the mask out in the community. I'm seeing it more and more out in the community. So they're just getting used to it. They adapt so easily at that age.
Agree.
I know a lot of parents, when this all first started, said that they wanted their children to wear a mask anyway. Could contacted their teacher, even for our youngers, to say, I want my child to wear the mask all day. And they've always worn them going, to specials and
Common areas.
common areas. We understand what lunch looks like, but coming from an elementary background, I haven't been an elementary principal for years. It's all about processes and procedures, and once they get used to it, and just that reminder. And do we know that yes, little kids are going to touch their face more, or little kids are, they're going to want to take it off, or they'll have issues. Yes, but a lot of them have already worked through that. They've had that time to kind of learn those procedures. They've seen the older kids wear them. They have a better understanding because their parents have explained why we're wearing a mask and what that looks like, and more about the pandemic. So there's not so much that fear factor because they have that understanding. And it really is, it's not the norm that we want, but it's kind of the norm they know. I can't tell you how many times I go out and I'll hear the mom or whatever say, come here, let's get your mask on or whatever. And, 2-year-olds on up, like I don't see the whining or the crying or any of that. They just kind of, and they'll put it on and they'll do their thing, or not a word, and they just put it on and life goes on.
Right. There was a question about masks being required on the buses, and that's addressed in our protocol as well. We're asking kids to wear masks on the buses. I'll be the first to say we struggle with bus drivers and the number of bus drivers. Sean's trying to find it in the guidance. I believe it's closer to the top under protocols, Sean, so maybe closer to, there you go, bus guy. Look at him, fancy, searching for it. But there is in the guidance, and this is the same guidance we've had from the beginning. We are asking our employees as well, our bus drivers, to wear the mask as long as it doesn't present a safety issue, meaning glasses fog up and those kinds of things. And we're trying to provide masks, the paper ones like the one I'm wearing tonight, for kids that show up without them. An interesting conversation we had in our leadership team meeting had to do with, hey, are the bus drivers giving out cloth, the disposable masks on the bus? And the answer is yes. And what's happening is I don't know that they're getting from bus to school with them. Sometimes they're getting another one. So just asking parents to be a little bit more conscientious about making sure kids have masks at school. We're sure going through a lot of them.
Definitely.
They're a little bit expensive, so we've just done our second order.
We have close to 5,000 students in our district, so if they remember their mask, that really is helpful.
Right. So let's move on to some of the other questions, and we'll try to answer all that are up here. I see 3 more. Let's talk about the first one. When we return to distance learning, since we are in dark red, and I will take that one. We have learned a lot since the get-go, and there are at least 3 different maps that we have presented to us on a weekly basis. One comes from the Oklahoma State Department of Health, which is the first one that came out, which is what we kind of hung our hat on, so to speak, at the beginning. And it, I believe, as late as Friday, they come out on Friday usually, everyone's orange, I believe, except for the panhandle of Oklahoma. There's another map. The State Department of Education developed another one with a 2 system of orange codes. And then the Tulsa Health Department has come out with another one. And it became very quickly noticed that those colors would change. And there were some districts that said that we were going to go by the color-coded maps that pulled closed school because of maybe a spike in prison or some other residential treatment facility in their district. And so we really are looking at our own local data.
Which is on the website.
It is on the website. We post it weekly on Monday morning. We wait until pretty late Friday afternoon. I know, Janelle, you have experience, so that process of quarantining could go pretty late into Friday. And so trying to be consistent in regard to how we're sharing that, that it is posted on the website. Sean's got that pulled up. When you pull the website up, Kristen, you might explain how that works.
Well, when you pull the website up, you'll have that little box, and then you can click on kind of what you're looking for. But Sean, will you go to the one that has the numbers, where we're posting the numbers?
Yes.
Yes. And I had a great question from somebody the other day about the overall number that's in there. Somebody said, well, we don't have that many students in our district. And but you have to know that's students and that's our employees. We have about 750 employees thereabouts in our district. So those two are combined, and because of confidentiality, we don't just post like teachers' numbers and students' numbers. They're all kind of in there together,
Right.
because it's against the law for us to share out for individual people. So to keep confidentiality, and being in HR, that's important. That's why the numbers are posted that way, and that's why you see that larger number, because we're all kind of lumped together in that.
So what Sean is posting, and this is not from the website, this is the data that we keep weekly. So Sean, there are tabs at the bottom of that. Are you on that one? Or is that the website one?
No,
That's the
I'm on the website one.
That's okay, you're good. So this was what was posted Monday based on the end of the day Friday. We had, at the time, 222 active quarantines with, I can't remember the cases until you, yes.
So this
that
is the
one.
last
Mhm.
week.
This would have been posted Monday with 23 current positive cases. And one of the questions, I believe, was how many of those cases are positive. So that would be a current number. So that would mean district-wide, we would have had, as of Friday late afternoon, 23 positive cases, trending to 222 active quarantines. One of the things that we are looking at very carefully is the number of staff that we have on quarantine or in isolation. And that really does trigger why and when we would shift to distance learning. For tonight's meeting, this is not something I typically do, but I thought it might be healthy. There was a question about was there a spike because of Thanksgiving? So this would have been Friday. It was up a little from the week. That's not true. Go to the week before Thanksgiving. There's the week right after Thanksgiving at 4:02, but go to 12:04, what was posted. So we actually showed a decrease. And then today, I just put current data from today. This is not something I typically do, but we did have some quarantines specifically at Clyde Boyd and Charles Page High School. One of the things I like to point out in this form is, so I wouldn't say there was a spike. To answer that question, I'm not sure I would call that a spike. We went from 23 to 27, I believe. But I will say, one of the things that is an interesting dynamic, if you look at the active quarantines, on this form, what's posted, we give you a percentage, and meaning that 5.72 people district-wide are in quarantine. Don't mess me up.
Sorry.
Are in quarantine. But if you think about that number, then you have to know that 95.38 are actually in school receiving services. So that's helpful, I think, for our team to see that, and also helpful for us to understand how many staff we have out that help us make school run.
I think there were some questions too when we went to distance learning. We put secondary on distance learning. We pushed the letter out, and it really, it has to do with staff and keeping kids safe, and can we facilitate the needs for the kids when we're in school. So definitely, employees being there are high on the list. And so, but when we released elementary and we went to distance learning, with Mrs. Durkee, and I know I'm just, being that person.
Right.
We were really only out 4 days?
3 days for elementary.
3 days. But the reason behind that was?
So we contemplated that. We met with our team. We were struggling at that time with quarantine and isolations with staff. It's hard to teach kids if teachers are not at work. And so, knowing.
And if you want a sub, though, we'll
shameless plug.
Yes,
for a substitute, that's for sure. But the thinking behind the reason we were out Friday is the calculation of a 10-day isolation period. So we knew we had some of our staff members that had tested positive, and a 10-day isolation period was enough time to meet our requirements for them to be able to return to work. And so that helped us come back to school. I will say our high number, our all-time high, happened right before Thanksgiving break, and we had 746 people quarantined that week. I believe you can find that, Sean, on the, keep going, you have to scroll over.
Yeah.
Oh, there you go. You've done it. You're smarter than me. And then right before that, week before, the highest number of positive cases at any one time in the district was 57. So again, we're seeing still, we may be trending up a little bit, but we're still pretty far down in comparison to where we were prior to Thanksgiving break.
There was another 6A district that it was on the news that they had closed just because of buses.
Right.
Like, so, when we were talking about, do they wear a mask on the bus? Yes, we need them to wear a mask on the bus. We have to keep our bus drivers safe because, we got to be able to get kids to school, and I don't have my license. It's not an easy
I used
test,
to have
but we
my
also
license.
need bus drivers.
There's a fun fact.
Right?
I used to have my CDL.
But that it's all those factors, and lunches and just all those people behind the scenes that you don't think about that to keep things going too.
I know we don't have a ton of time. I'm not seeing more questions, but I am going to end with a story. I told this at leadership today. I know they're probably tired of hearing me tell it, but I had an email from a teacher, and you know how grueling it is to even call snow day. You know that because you watch us just stress about a snow day. So calling,
calendar, yeah.
Oh my goodness, and calling us kids out of school is so hard. But I had an email from a teacher that I highly respect, and she told a story about delivering some supplies to a family in need not too long ago, and the kids were in the parking lot of this apartment complex, and they were out in the cold rain with no coats and no supervision and no learning. They were out of school in distance learning. And she said, I went home and I cried because she was so proud of us because our kids were getting taught, coming to school. She said, at least we know how they learn and how they learn best, and we can teach them. And we formed relationships with them. And so if we have to shift to distance learning in the future, we at least know them. And she said, I'm just
That's
thankful.
Not meaning we are.
No, we're not, hopefully.
I'm looking at the data.
But it is based on our data. It is based on our ability to provide services for our kids. And mental health at this point, isolation is not healthy for people. And we can't deny the fact that there are mental health issues because of just increased anxiety with people in general. But, kids aren't immune from that. And so I hope that serves as maybe kind of a story about the why. And I don't know if you all want to add to what we see, but even on a snow day, what goes through my mind sometimes is, are they warm? That sounds very basic. Are they hungry? And do they have supervision? And we have kids in our district that don't have that. For us sitting in this room, if I call this snow day and you had a little one at home, you would not have a problem. But there are folks that don't have access to resources that are necessary for children. So none of that's taken lightly. It's all done with definite caring for doing what's best for kids, for sure. We do have options for learning. We have our virtual academy. I know Sean's sitting over here off the camera, but I know you, Kristen, can speak toward virtual academy and the robust nature by which we formulated that over the course of time. I don't know if you want to speak to that or not, but.
Well, we've had great success, and we have had some kids that started virtual and then have gone back in, and it's really hard for kids to have that transition where they flip-flop. So we've just really been cautious, and honestly, our counselors have been pretty protective over some of those kids, or kids that they feel that maybe would be less successful in one or the other, and working with Jay Roeder, who's the director for our virtual school. And so I just think we've done a fantastic job, and it's so hard sitting in this position. We are as transparent as possible. I can't give you a list of names because of confidentiality, but there's no decision that we take lightly. I think we're either all going to lose a bunch of weight or gain a bunch of weight, not just because we're isolated at home with COVID, but just
really
the stress.
Depends on how you take stress.
Yeah, it depends on how you take stress. But we care about our Sandite families, and that's everybody. That's our employees, and that is our school age kids, and those that we don't have yet that might be heading our way. And we just want to do what's best, and it's so hard. And I know a couple families personally that and these aren't adults that have just phenomenal jobs, and literally they're not working right now, and they're staying at home with their 3 kids and trying to teach them and make ends meet. And we don't like to make snap decisions for distance learning. That's not our goal, because we know it puts you in a bad place, but it all goes back.
I'm going to put in a shameless plug for Sand Springs Community Services, and not because Nathan Woodmancy has asked me to do this. I got a letter in the mail asking for a donation, which it's a great cause. They provide a lot of monetary and food to our population. But in the letter that was asking for a donation, a statement was made that they have 40%. First of all, they've given away like $200,000 worth of supplies and money and financial help for people, but 40% of those that have taken advantage of their services this year have never utilized community services before. And it's the time that we're in. When you say unemployment as being a condition by which some families are, it's a true thing. So I don't want to belabor that, but again, I know that Janelle and Lindsay are working their heads off to try to make things good and safe and all of those things for our students and our staff. And
this is a strong community.
It is,
and we will make it through. So
I'm proud. I'm
on vaccine and
absolutely.
let's make it safe. So
I don't see any more questions in the chat. I thank you for watching us tonight. This will be on our YouTube channel for a while. And so definitely you can go back and watch it if you have any questions. But by all means, if you have questions, there's always someone available at our office, but also at the sites to answer questions that you might have. So any last comments, you two?
No, I just appreciate the support we have from the community. It's this team effort.
It is a team effort. I love this team.
you can share this with others. And when's our next?
January, but we don't have it on the calendar yet. So we really were going to approach this next Tuesday and kind of spread it out away from our monthly board meeting. But because we had changed the guidance, we felt like it was really needed to get out tonight and have this conversation with our families. And so it'll be in January, likely early to mid-January.
And do they wear a mask or do they not wear a mask? It's not on the report card. Teachers will work with them. They've already been doing it.
Yes.
So
Absolutely. All right. Well, thank you for joining us, and we'll see you next time.